Myself, Dr. JIBRAN Ahmad presents to you Simply Pathology, and today we are back with a very important session. So as you can see from the thumbnail, today's topic of discussion is how you are going to plan your final 3 months just before your university MD DNB pathology examination. Okay, so this lecture is very important for all the exam going or exam appearing students. Not only that, all those who are in the first year as well as those of you who are in the second year, you are also welcome to watch this video because it is going to give you a very deep insight into the list of topics which are very important for your exams, as well as you will understand how a MD or DNB pathology examination is conducted, okay, according to the National Medical Council guideline. Okay, so this particular lecture, this is aiming at not only the exam going residents, but it is also aiming at the first years and the second years. Okay, so among the exam going residents, okay, there are some of you who have read thoroughly from the beginning. There are some of you who have read, but you have read very less. Means in the first year you have not read, in the second year you started reading, and now in the third year you have become serious about that. And there are those students who have just not touched the book. They have just read something here and there, but they have not done any kind of learning in all the 3 years, and now you have just 3 months of time to prepare for your exam. Okay, so this video is going to be helpful for all this 3 category of students. So what will be the components that are going to be discussed in today's topic of discussion? If you see, firstly, we are going to discuss that what are you up against, okay, as in, okay, what we are going to discuss that what are the components of the postgraduate examination for pathology, okay, as given by the National Medical Council. Okay, now this particular component might vary from college to college, and all of the colleges may not follow the NMC guidelines strictly. The second component that we are going to discuss today is what is the time in hand and how you are going to utilize this time, okay, for your approach. So you are having basically 3 months of time, 90 days time. Some of you are having exams in the month of September, some of you are in the month of October, and some of you in the month of November. So I will basically take 3 months plus minus 30 days approximately. On an average, what I will take is 100 days time you people are having for your exam. Okay, the third important thing is I am going to teach you or give you a mathematical approach with the exam timetable. Okay, and this mathematical approach, okay, for following the timetable that I am going to share with you for your exams, how you are going to read, how much time you should allocate to different subjects, and how you should go about your exam preparation. Now this timetable is so flexible that it is basically applicable to all those students who are working in the last 3 months, as well as all those who are just attending the college but they are not working, but they are just sitting and reading. And it is also applicable to those who have got 3 months of complete exam leave. Okay, so this is applicable for everyone. Okay, the fourth important thing is I am going to share you all the important counseling and tips on how to achieve the targets and prevention of procrastination, of frustration, of fear of exams. I am going to share how you can also deal with them. So you should concentrate on your studies rather than what your peers or your colleagues are doing. Fifth important thing, the exam etiquette and the manner that you have to follow, and something that is new, okay, this year that I am adding in this particular video is the question paper pattern. What is the pattern of question paper that is always asked, okay, and how you have to deal with the questions in the exam. Okay, so without wasting any time, let us begin today's topic of discussion. So first I am going to try to make you understand that what are the different PG exam components. So unless and until you understand this, okay, you will not have an idea that how you have to approach the exam. The first important thing, the first and foremost thing that you should complete is your thesis. And according to the NMC, the thesis should be completed at least 6 months and submitted and accepted before 6 months of your exam. The thesis should be completed and accepted. Okay, then comes your theory exam. Now for passing the theory, at least 50% marks is needed, okay, to pass the theory. So according to the National Medical Council, okay, you should have 4 papers, okay, and each paper they carry generally 100 marks. So total you are having 400 marks of theory. Okay, so you are having the paper 1, which is comprising general pathology, immunopathology, as well as the molecular pathology part. The paper number 2, which comprises systemic pathology and cytopathology. Paper number 3, which comprises hematology, clinical pathology, blood banking, as well as it might include tissue processing as well. Along with that, you are having recent advances, which is basically the paper number 4. Now, this division is not my division. This is a division which is given by the National Medical Council. So tomorrow, don't tell me that, sir, you told me this, so I have read for this paper. No. Remember, although this division has been given by the National Medical Council, but different universities are there which are having their own guidelines. And till now, all the universities, they are not properly following the exam guidelines given by the National Medical Council. So they are yet following their own pattern or their own university guidelines they are following. So you please check with your seniors, okay, you please check with your professors, your HOD, and look at the last 5-year question paper, so you know what is the pattern of question paper for your college or for your university. Okay, remember this fact. Okay, this division is not from my side. This division is from the NMC. Okay, more or less the paper is divided like this, but there are certain changes. For example, in certain universities, okay, recent advances might be introduced in all the 4 papers. Even in paper 1, they might give recent advance. Even in paper 2, they might give recent advance. Even in paper 3, they might give recent advance. Okay. Again, hemat question may be asked in paper number 1 also, or it may be asked in paper number 4. Systemic path question may be asked in the paper number 4. So the division of these questions are very rough. So more or less 80 to 90% of the questions will come for that paper only. But remember, few questions can come from the other parts as well. So remember this, very importantly. So this division is not strict. This division is quite variable and it varies from college to college. Okay. Second important thing, just remember, even in your college, for example, they are having certain pattern. Remember, it is not like hemat is always asked in paper number 3, so it will always come in paper number 3. They might ask you iron deficiency anemia in paper number 1 as well. Okay. Similarly, they might ask you, about diabetes mellitus in paper number 4. Happened with me personally. So it is very important that, in every paper, majority of the questions will come according to what they are supposed to give. Few questions might be here and there. Okay. So something of everything, okay, might come in your paper. Okay. Irrespective whether it is paper 1, 2, 3 or 4. This is what my, this is what I was trying to, let you know. So this is the rough division. It might be different from your university. You are supposed to follow whatever your university is following. However your university has divided, you follow that. Okay, but always remember, even after how your university has divided, you might have some questions from some other paper as well. Now, according to the NMC, they are saying that you can ask one long answer question followed by 6 to 8 short answer question. But remember one thing, this pattern is given by NMC. There are universities, okay, they are asking in a very different format. For example, there is the West Bengal University or the Bihar board also. If you see, they are asking you 10 questions, each question carrying 10 marks. Okay, so it is 10 into 10, that is 100. Okay, there are certain, so there are 10 questions and all of them, they are long answer question, or there might be one question with 2 short answer question. Okay. So basically any one question is carrying 10 marks and there are 10 such questions. Any one question can have 2 divisions with 2 short answer questions as well. So this is one pattern that they are following in West Bengal board. For example, in the Gujarat University, they are having 2 LAQ, 2 long answer question mandatory that you have to answer. It is 50 marks. And suppose they have given 6 short answer questions. Okay. Out of that you have to answer any 5, each carrying 10 marks. Okay. So it is again 5 into 10. So again the total is 100. So what I am trying to tell you that the exam pattern might vary from university to university. Again, you might have to check this with your university or with your respective college. Okay. So this is the way that you have to go for the theory exam. And theory is very important. You have to pass, separately inside theory. You have to pass in the thesis as well as, you have to pass in the practicals. So your thesis should be approved. Your theory you should pass and practical also you should pass separately so as to pass the entire MD examination. Okay. Now the third important component for your exams is your practical component or the practical examination. Okay. Now this practical examination has several divisions. So this is again very important, and the practical examination, it carries 500 marks. This is standard. Again, this can vary. And out of this 500 marks, 100 marks is basically for your internal assessment. What you have done in the past 3 years, it is about that. Okay. And practical examinations are usually conducted over a period of 2 days, should be conducted over a period of 2 days. Okay. Whereas theory exams is done, 1 day, 1 paper. Now you might have, 4 papers consecutively, or you might have a gap, 1 day gap also between 2 papers. Okay. So let us see the division that you get in the practicals. So in the practicals, number 1, you are having the histopathology, which carries 150 marks. So under this section, you will be evaluated by the help of slides. So you will be given the exam slides. Around 12 to 15 exam slides you might be given for histopathology. Also under the section of histopathology, you have grossing and autopsy as well. Okay. Now under the section of under the next section, we are having cytopathology and your histotechniques or cytotechniques. This is carrying approximately 80 marks. So what does it comprise? It will comprise approximately 5 to 8 slides will be there. Okay, of your clinical pathology slides can be there. So cytology slides can be there. You will be asked about the histocytological techniques as well as special stain exercise might be there also under this section. The next section is hematology, clinical pathology, blood banking, which is carrying 120 marks. Again, the hematology slides will be there. The clinical pathology, the problem exercises can be there. Okay. You might be given, blood grouping, or you might be given a task for blood grouping or cross matching, or to perform Coombs test, or for gel card interpretation as well. Okay. And lastly, you will be having something called as the grand viva or the thesis. Okay. As well as the viva on the basic science, which will carry approximately 50 marks. Among them, you will also have something called as the micro teaching. Okay, so this is just the broad divisions that I have let you know, that there will be a histopathology section, okay, comprising the HP slides, grossing, autopsy, cytopathology and histotechniques comprising the cyto slides, histocytotechniques, special stain exercise might be there. Then there will be your hematology, clinical pathology, blood banking section with the corresponding slides, as well as blood grouping, okay, cross matching and the problem exercises for clinical pathology. Along with that, in the clinical pathology, you might have to perform certain biochemistry test as well. I will discuss in details about them later on in the same video, but later on I will discuss about them. This is just a broad headings. Okay, so you might have all of these things. In biochemistry, you have to do the urine analysis. Okay, you have to do the urine routine examination, or the urine protein, urine sugar you have to do. Okay, you might have to take the blood sample, as well as you have to give your pinprick and prepare peripheral blood smear as well. Okay, so I will discuss about them later on. Right now I'm just giving you a broad idea. And under the section of the grand viva, you will also have, under this section, a part of micro teaching will be there, wherein you have to teach a particular topic. Okay, I will discuss about that later on. Okay. So these are some of the broad divisions. Now I am going to discuss individual part. Now about the thesis part, the thesis should be approved, okay, accepted, approved and submitted at least 6 months before your theory examination. Now coming to the theory, now it is very important for you to understand that theory is very, very important, and this is the part which is, maximally avoided or neglected by the residents. You should never underestimate. In the last year, we had a pass percentage of more than 99.58%. Okay, of the total number of students who have appeared in the examination, approximately close to 1500 people had appeared in the examination. Approximately out of 1500, 5 people have failed, and you will not believe, these 5 people who have failed, they were from the MD, not the DNB. We had 100% pass percentage of DNB residents. But having said that, the proportion of DNB students enrolled with us was far less compared to the proportion of MD students. So for example, approximately around 10 to 15% students are DNB, whereas 80 to 85% they are MD students, and approximately 5 of them have failed in the exam. And to be very honest, all these 5 residents, they have failed because of their theory. Everyone has passed in the practical, but they have failed in the theory. So remember, theory is most important. And why theory? I'm always laying more stress on theory. I will tell you the reason also. Now suppose the theory has been checked, so whatever you have written, okay, you have documented everything. So whenever the examiner has to check, he has to give proper marks. He He has to write it properly. He has to give a breakdown of all the marks that he have given, that why he has given that marks, and he has to have a signature over there. So every examiner will check very thoroughly. Okay, so if for example some kind of changes of marks has to be done, they might be able to change your marks here and there in the practical, because everyone is not there to see in your practical, but they will not be able to help you in the theory, because theory is completely documented. Everything is documented. That is why I always tell you, during your theory exams, do not leave any questions unanswered. Whatever you know, you fill up the pages at least, because if you do not fill up the pages or you will leave any answer blank, the examiner cannot give you any marks. Okay, remember this point very, very, very clearly. Whoever has failed, they have failed in theory only. Okay, they have failed in theory only. Remember this point. Now remember one thing. First, remember what should be your approach for preparation of the theory. The first important step is to take or to aggregate or to get hold of 5 to 7 years last year's question paper. So for the last 5 to 7 years, for example, if you are appearing for 2025 examination, okay, so the last 5 to 7 years from 2017-18 onwards till 2024, whatever question papers are there, you should have solved those questions. So that is the first thing that you have to gather. After you complete the last 5 to 7 year question paper, then only you go for the remaining important topics, okay, that I am going to discuss, all the important topics, okay. So very importantly, you have to see the last 5 to 7 years question papers. That is the first line, and after that you should go for the remaining topics that I have given. So among the topics, I have divided them, okay, accordingly. The first important group of topics that I am going to discuss is the systemic disorders. Now these are certain questions where there is a 100% chance that these questions will come, and these questions are the easiest and the most basic questions, and they are always included in the paper because they want you to pass. So these are the questions that are going to help you to pass, and you should not miss these questions. Now whatever was already there in the last year, they are there, but there are certain questions which are being added in this particular group from this year that I am going to share with you. So what are these important systemic disorder questions? So you are having diabetes mellitus, okay, atherosclerosis, myocardial infarction, Alzheimer's disease, obesity. Then you are having alcoholic liver disease, non-alcoholic fatty liver disease, SLE, HIV, amyloidosis, Prion's disease, hypertension. Then you have pheochromocytoma, MEN syndrome, Down syndrome, Klinefelter syndrome, Fragile X syndrome, cystic fibrosis, familial hypercholesterolemia. Now what are the questions which are added for this year or which are important for this year? Phenylketonuria has also made to this list. Phenylketonuria or vitamin D deficiency also, as well as your Gaucher's disease and Marfan syndrome. Then other important questions include cardiomyopathy, okay, role of ionizing radiation in carcinomas as well as radiation carcinogenesis, role of diet in cancer. Then the peptic ulcer disease, polyps of the GIT, inflammatory bowel disease, maltoma, tuberculosis, ARDS, iron deficiency anemia, megaloblastic anemia, pernicious anemia, and all the leukemias, okay, acute myeloid leukemia, acute lymphoblastic leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia, okay. Then we are having MPAL, mixed phenotype, acute leukemia or acute leukemia of ambiguous lineage, CMML, JMML, Hodgkin's lymphoma, okay, adverse blood transfusion reaction, SIDS, that is sudden infant death syndrome, okay. Now remember about SIDS, okay, the notes are already present under the handwritten section. Remember one thing I am saying again, in our website and application there is a handwritten note section. So many of the topics that I have mentioned you over here, you can directly go and read from the handwritten notes which have been uploaded in the website or the application, okay, very importantly. Secondly, there are some questions which are not there in the application, but I will let you know from where you should read. If I have not mentioned anything, that means they are already available in the website or the application, okay. So you just have to go and you have to see the website and application as well as the handwritten note section, okay. Okay, other topics I have already shared in the WhatsApp groups, in the third year groups as well. So you might go and check the groups for those questions. And I'm also going to let you know from where to read. For example, phenylketonuria and vitamin D deficiency. These topics, both these topics you will not find in the app, so you should go and read from Robbins directly. You go and read from Robbins. It is discussed very beautifully in the Robbins, okay, whereas rest of them they are discussed in details, okay. Then we are having organisms, which has been covered in the application. So all the organisms which are relevant in pathology, like malaria, dengue, rhinosporidiosis, aspergillosis, leprosy, kala azar, mucormycosis, actinomycetes, filariasis, okay, novel coronavirus, COVID-19, all these have been discussed in details except the coronavirus. Now I will tell you what questions are asked from COVID-19. Now though COVID-19 is not a very important topic, the diagnosis of COVID-19 using RT-PCR. I have shared a very beautiful article regarding the diagnosis of COVID-19 in the third year group, and I will share again shortly after this lecture. In a day or two, I am going to share all important exam material inside the third year group in the WhatsApp. Apart from that, any other question, means post vaccination problems, or heart related problems, liver related problems, or hematological problems of COVID-19. Hematological problems of COVID-19 has been discussed under the section of recent advanced hematology. That is a part of recent advanced hemat 4, and this has been covered in the website of the application, okay. Whereas the rest of the important questions you can directly see the PDF of recent advanced histopathology 25, which is mainly dealing with your COVID-19, okay. So these are the COVID-19 related questions that you have to read, and the sources I have already discussed that where you have to read from. Apart from that, we are having mercury or lead poisoning, tobacco effects are there, alcohol effects are there. Then Kwashiorkor marasmus, again this is not covered. Kwashiorkor marasmus you have to read from Robbins directly, okay. Other important topics include viral hepatitis, autoimmune hepatitis, drug induced hepatitis, MEN syndrome, cutaneous lymphoproliferative disorder. Now all this is covered. If you see autoimmune hepatitis and drug induced hepatitis as well as cutaneous lymphoproliferative disorder, they are covered under the section of handwritten notes inside the website and application. You will see the handwritten note section where already this has been covered, okay. So these are some of the must know exam questions where there is a 100% chance that they will come, and these are easy questions and you should answer these questions, okay, without any miss. You should answer these. Now the next group of questions that I am going to discuss is from systemic pathology. Now you already know that systemic pathology is vast. So I have given a list of topics over here, and among the list of topics, the one which is marked with red, that means they are very important. Others are important too, but these are more important. And then the ones which are marked with pink, these are the ones which are basically added to this list, okay. From last year I have added this. Last year these were not there, I have added them to the list this year. So let us see. Very importantly, in the systemic pathology you will get some of the other classification, okay. So classifications, a simplified version of the WHO 5th edition classification has to be remembered. A simplified version, where it has been possible, I have included them, okay. I have included them. All the classifications are important, and all the club classification I have already shared in our announcement group several times, okay. So all the classifications are already shared, okay, in the groups, in the announcement group. So important classifications like ovary classification, okay, gestational trophoblastic disease classification, or basically classify skin tumors, or classify tumors of the breast, or classify tumors of for example kidney tumors you have to classify, or classify adnexal tumors of the skin, okay. So these are some of the important classification, or classify lung tumors, okay. So these are some of the important classifications that are asked repeatedly year on year. So if you just go through your last 5 to 7 year question paper, you will see that 7 to 8 classifications are always asked, okay. Then grossing very commonly they are asked: grossing of the breast, grossing of the ovary, grossing of the colon, grossing of the prostate, grossing of the penis, or grossing of the testis, or grossing of the ovary. You have to write down the steps. This is again a direct question. So some of the other grossing will be there. Then very commonly asked question, that is small round blue cell tumors. Small round blue cell tumors are very commonly asked, and what I have added this year is the round cell sarcomas of the bone or soft tissue also is asked in the exam. Very commonly asked. Then you are having your IHC of soft tissues, okay. Discuss immunohistochemistry of IHC of soft tissues are very commonly asked. They might ask you about the IHC of genitourinary system or IHC pertaining to the ovary, of the female genital tract, especially the ovaries. Okay, they might ask you in details. Then WHO 5th edition changes. So what are the changes in the current 5th edition? This question might come in, it's a recent advance 4, means it is a paper 4 question, but it might be asked in paper 2 as well. So all the WHO 5th edition changes, okay, and what are the updates? It has been discussed separately in each of these sections of systemic pathology. Whatever systemic disorder that I have discussed over here, all this section on the systemic disorder, they might be asked, okay, in paper number 2 as well. Like atherosclerosis, diabetes mellitus, they might ask you in the paper number 2 as well. Then the staining. Now staining can be asked anywhere. H&E staining, PAS staining, okay, any other special staining, or they might ask you to discuss about any IHC marker. For example, cytokeratins, they might ask you. This has already been covered under the section of handwritten notes, okay, and they are already discussed, for example, in different places, okay. Accordingly, chapter wise they are discussed. So any specific IHC marker they might ask. For example, cytokeratins, a very important long answer question asked in the exam. The handwritten notes for which is already present under the handwritten notes section. Then they might ask you to discuss the molecular pathogenesis of any, for example, molecular pathogenesis of brain tumors or molecular pathogenesis of breast tumors, okay, any molecular pathogenesis of any chapter, for example, pancreas, endometrial carcinoma, ovaries, any of them can be asked in the exam. Okay, now the syndromes, different syndrome like familial adenomatous polyposis, Peutz-Jeghers syndrome, HNPCC, hereditary renal cell carcinoma syndrome or breast carcinoma syndrome. The RCC syndrome, hereditary RCC syndrome, handwritten notes, again, it is discussed under the heading of handwritten notes. You can see from there. Then we are having neuroblastoma, okay, separate lecture is there. Pediatric renal tumors are there, okay, again separate handwritten notes are also present for pediatric renal tumors, and also video lecture is also there. Then rheumatic fever, endocarditis, aneurysms, or approach to the diagnosis of lymphoma. Again, this approach to the diagnosis of lymphoma, it is present under the section of handwritten notes. Okay, approach to the mediastinal tumors, again it is present under the section of handwritten notes. Okay, then obstructive lung disease, pneumoconiosis, pneumonia, sarcoidosis, lung carcinoma, paraganglioma, sinonasal neoplasm, gastric carcinoma, colorectal carcinoma, malabsorption syndrome, again it is very important. It came, all these questions they were asked last year also. Microsatellite instability, MSI. Now MSI is discussed in details under the section of colorectal carcinoma. Also it is discussed under the section of recent advanced 23-24, the notes of which are available in the handwritten section. But remember, for MSI, you please search for certain articles. You search articles in Google Scholar. Just search certain articles in Google Scholar. You will get very good articles for microsatellite instability, or I will share one article for the same in the third year group also. But this is a very important question. Okay. Then other questions like autoimmune hepatitis, metabolic liver disease, hepatocellular carcinoma. So remember, autoimmune hepatitis and metabolic liver disease, okay, the handwritten notes are available. The handwritten notes are available for the same under the section of handwritten notes. You will find, all these answers. Then pancreatitis is there. Then in this year, one very important question last 2 days only came, that is autoimmune gastritis. This is a new question which has been introduced this year in the RGU HS exams. Okay. Then certain other questions like mechanism of glomerular injury, RPGN, okay, that is rapidly progressive glomerulonephritis, or PSGN, or renal cell carcinoma. They can be asked in the exam. Liver, renal, muscle biopsy, all of these are discussed. Cystic disease of the kidney, lupus nephritis, IgA nephropathy. One addition to this year is renal transplant rejection, and what are the factors influencing renal transplant rejection. Again, this has been added this year. Okay, you will find the answer. One article I have shared about the factors affecting the transplant rejection, and renal transplant rejection already has been discussed in the app, okay, in the relevant section. Then testicular tumors, the germ cell tumors, BPH, benign prostatic hypertrophy, prostatic neoplasia, as well as prostatic specific antigen or GCNIC. Okay, all these are important questions which will be asked in the exam. Okay, I have also missed, and I want to add one more topic over here, that is the urothelial tumor. discussed in detail about the urothelial tumor. So you might be asked to classify the urothelial tumor, and you might be asked to write the morphology of some of the important group of urothelial tumors. Okay, this is also important. I'm adding over here. Then under the ovaries, germ cell tumor are important. Under the uterus section, endometrial carcinoma can come in the exam. Under the cervix, what is very important is HPV testing. That is the molecular testing of HPV is very commonly asked question in the exam. What I have added over here, along with that, the screening of for cervical carcinoma, might come as a separate LAQ. Gestational trophoblastic disorder, it was always an important question. Always one question is there, and this year, okay, it has also come in recent advanced 27, and always they are asking question about the gestational trophoblastic disorder. Okay, then prognosis of certain carcinomas like breast carcinoma, melanoma, or even prognosis of prostate carcinoma. Okay, prostate carcinoma prognosis, they might be asked in the exam. Then gastric and pancreatic neuroendocrine tumors, NETs, neuroendocrine tumors are very, very important. Along with that, what is very important is GIST, gastrointestinal stromal disease. I think I have missed GIST over here. GIST is not here, but GIST again is a very important question, okay, which is asked in the exam. Then about the thyroid, you should just read the basics of hypothyroidism, hyperthyroidism. You should just read the basics about that. Then very important, squamous cell carcinoma, melanoma, okay, precursor lesions, that is the nevus, okay, all these things can be asked in the exam, okay, relating to the skin. Adnexal skin tumors can be asked as well. Adnexal tumors of the skin is very important. Very important LAQ which is asked is vasigobullous lesions. And one important thing that I forgot, I'm adding right now over here is psoriasis. Psoriasis, the pathogenesis of psoriasis, as well as the microscopic examination and the histopathology of psoriasis is very commonly asked in the exam. Came last year also, okay, and I will be covering them also very soon in our website and application. Psoriasis can be asked in the exam. Then bone tumors, about the bone tumors, everything, okay, very important thing that is asked is the giant cell containing lesions, already discussed in details, and already one important PPT already shared in the third year group about the same. Then molecular pathogenesis of the soft tissue tumors, okay, rheumatoid arthritis, osteoarthritis, Paget's disease, okay, reactive lesions of the lymph node. Now this has not been discussed in the application right now, but very easy 2 pages given. You can read directly from Robbins. You can read directly from Robbins about the reactive lesions of the lymph node, the non-neoplastic lesions. You can read from Robbins, okay, in details it is there, and it is also discussed under the cytology section, under the lymph node section, okay, wherein both cytology as well as histopathology has been discussed together, but in Robbins they have given in short, so for exam purpose it is very suited, okay. The other important topics include muscular dystrophies, peripheral nervous system tumors as well, okay. Muscular dystrophies, they are important, like DMD, Duchenne's muscular dystrophy is asked in the exam, okay. Apart from them, these are the most important questions that you cannot miss for your exams. And systemic pathology is vast and it is very huge. You cannot just know each and every question. You cannot just go and read each and every question. First complete these questions, okay, that is very commonly asked in the exam. Then and only then you can go for some other group of questions, okay. So I hope this is crystal clear to everyone what you have to read and what you have to concentrate more on, looking at your systemic pathology questions, okay. Now comes the general path. Now among general path, the first 7 chapters, okay, they are very important, okay. The first, every topic means under general pathology is not like, I can give you any one topic that, okay, you go and read this particular topic. No, everything, 100% of general pathology is important, and they can ask you question from anywhere, okay. There is no repetitions, they are asking just anything from anywhere. So general path is something which is very important, and why it is important, it is very scoring also, because whatever you will read, it will come from there only. So first you start with the 5 to 7 year question papers, and then you go for everything, okay. Now under the section of cytopathology, okay, hematology and clinical pathology, so what you should read is the updated reporting protocol. So whatever reporting protocol is there, the Bethesda system of reporting is there for thyroid and for cervical carcinoma, or the cervix reporting. Then you are having the Milan system for the salivary gland. Then you are having different system for the lymph node. Now for the lymph node, spleen, for the pancreatobiliary and the lungs, WHO reporting system, cytopathology reporting is there, and this is an addition in this year. It might be asked, and we will try to cover it before the exams as well. Then what is ROSE? This can be asked this year, rapid on-site evaluation. Then last year they have added one question, that is NABL, the ISO 15189/2022. It was asked in the Gujarat University, and minimal residual disease is very important. Other questions which can also come, which I am adding over here, is LCH, Langerhans cell histocytosis. This LCH has been covered under the section of lymphoma in details. Okay, so you don't have to worry about that. Okay, so these are some of the important questions. One important question I would like to add again under the systemic disorder that can be asked in the exam. Over here we don't have a space, but I am adding over here where I have added the different leukemias. Very importantly, you should add Hodgkin's lymphoma as well, which is a very important addition that I forgot to add. Hodgkin's lymphoma is also a systemic disorder question which they are asking very commonly. You classify, discuss the histopathological features and the immunohistochemistry of Hodgkin's lymphoma. Okay, this is very important. Okay. So under the cytopathology, as I told you, the updated reporting protocol, along with that the WHO reporting cytopathology reporting system for the lungs, pancreatobiliary system, lymph nodes, spleen, thymus. This can be asked. ROSE, NABL, ISO 15189/2022 and MRD, LCH, these are just added this year. Okay, in addition to whatever was there. Along with that, we have also added whole slide imaging. Now certain questions, okay, artificial intelligence I have already discussed 2-3 days back, and it has been uploaded. This is a short question. It is a RA27 question. It is 100% this will come in this year's exam. Okay, digital pathology and whole slide imaging you can read directly from Pranab. It is given in short over there. Okay, you can read it from there. These are equally important. They will come in the exam. Okay. Along with that, what are the other important topics under this section is quality control. Quality control in cytology, hematology and clinical pathology. They are same and they are discussed in details. For cytology, if you want to see, you can again refer to Pranab. They have given in very short, and most of the quality control QC measures of cytology, they are overlapping with hematology and clinical pathology. Now QC for histopathology, HP I have already discussed, and it is given under the tissue processing section in the app or website. For the blood banking, QC of the blood banking, okay, how will you carry out quality control in blood banking? This is a very upcoming question. It will be asked in the exam, and though we have not covered it yet, but I have shared a particular book in the third year group, the first chapter of which is based on the quality control in the blood bank. It's again a very important question that you have to read. Then you have liquid based cytology, cell block, automation in cytology. Automation in cytology and LBC, they are discussed together, and cell block, if you see, they are given under the handwritten notes section, and rest of them they are there in the website application. Then the next important topic, LAQ, which is asked is immunocytochemistry of unknown primary. Biomedical waste management, again it is very important, and it is discussed in short in Pranab Day. And biomedical waste management we have also discussed when we have discussed the quality control for hemat lab. Then the proliferation markers, differential diagnosis of jaundice, the urine examination, organ function test, okay, CSF analysis, okay, semen analysis, any fluid analysis, infertility, okay, all these are important. One more thing that I would like to add this year is synovial fluid examination. This is an addition for this year, okay, that is your synovial fluid examination is an important addition for this year. Approach to coagulation disorder or approach to thrombophilia, then the platelet function test, thromboelastogram or ROTEM, again all this lecture has been covered. So as I'm going forward, just remember, if you are not able to find a particular video, then please search the handwritten notes section in the website application. A lot of questions from here, the notes of which are present inside the handwritten notes section. Okay. Then next important question is APLA syndrome. Blood banking is there, autologous transfusion is there, hematopoietic stem cell transplant, HLH syndrome, IgG4 disorder, thalassemia, sickle cell anemia, hereditary spherocytosis, immune hemolytic anemia, PNH, acute leukemia is already under the systemic disorders I have given. Okay, bone marrow failure syndrome, these are all added over here again. Bone marrow failure syndrome again is very important repeated question. Then how will you approach hemoglobin disorders or hemoglobinopathies? Okay, that is a separate question. Then HPLC again is very important among all the different process, and I will discuss that later on. Automated cell counters, again it is discussed already. Bone marrow aspiration, bone marrow biopsy is there. Then among the various kinds of molecular processes, okay, over here I forgot to add one more thing that you have to add is HPLC. Again an important exam question is there. So what are the important topics? Electron microscopy, immunofluorescence, IHC, PCR, flow cytometry, FISH, tissue microarray, next generation sequence or Sanger sequencing or cytogenetics. All of these are covered in the application except electron microscopy. For that you have to read from Pranab. Okay, just read from Pranab, whereas rest of them they are covered in the application. Then the tissue processing part again is covered. Example, the fixatives, the staining, okay, the frozen section, everything is covered in the application. Then you are having the cytochemistry part as well. Then all these new things we have already discussed, that these are the additions for this year, and you know these are some of the important things which are important for this year's exam. Okay, so these are the list of the important cytopathology, hemat, clinical pathology topics are there. Then apart from that, you already know when you are in the first year you are having an exam on research methodology and biostatistics. Okay, then some questions based on ethics might be there, and you have to complete a course on ACLS and BCLS also, okay, for your course as given by the NMC. Now coming to the recent advance, now remember recent advance in itself is a huge topic, and I will have to make a separate video on recent advances. Already one video is there, but this year what is very important, till last year I had given till recent advance 25. Now what has happened, that recent advance 26 and 27 has also been included. Now you have to remember that recent advance questions are based on recent advance histopathology, recent advance hematology, all the journal club topics, okay, which is corresponding to the college. Now for example, in your college you are having journal club, okay, so there must be a list of topics that was discussed in your college. So respectively, because if you look at the journal club topics, there are thousands of journal JC club topics. You cannot do all of them, but you do, you read those ones which are discussed in your college. Along with that, the WHO 5th edition updates can be asked, and any question, and under the recent advance, a question from paper 2, paper 3, paper 1 can also come under the RA, recent advance paper. Now about the recent advance histopathology, remember, now the ones which you are supposed to read is recent advance 23, 24, 25, 26, 27. And among the recent advance hemat, you have to read recent advance 1, 2, 3 and 4. Now what is the addition over here? Okay, in contrast to last year, just a month back they have introduced RA 27, and I have also started the recent advance 27 topics which are already uploaded in our website and app. Means we have started to make topics on that, and by the time your exam comes, this RA 27 will be, the podcast series will be complete as well. Okay, so very importantly you have to remember, in the application the RA 23 and 24 they are given under the handwritten notes section, okay, whereas RA 26 podcast and RA 27 they are discussed separately. Similarly, the recent advance hemat RAH4, the recent advance hemat, the fourth one is given separately, and important topics from 1 to 3 they have been discussed in the same hematology section, okay, elsewhere in the hematology section, whereas the recent advance hemat 4 is discussed separately. Okay, so all these topics you will find under the handwritten note section, and along with that in the relevant sections in the application or in the website. Only RA 27 is a new addition over here. I don't know whether recent advance hemat 5 will be released or no. So if they are released, or if they want to release, and if you know about that, please do message me. Then I will purchase this book, and I'm going to read and make dedicated videos on recent advance hematology 5 as well. Okay, but as of now I cannot find any source of recent advance hematology 5. Okay, so this is basically about all the important topics over here, okay, that can come in our exam, and about the recent advances as well. And this is mainly about your theory exams. Okay, this is mainly about your theory exams. Okay, now coming to the practicals. Now in the practicals I am going to tell you how you have to approach. The number one thing which is asked in the practical is the slides. So you have to write down the description. Okay, this description is basically carrying some marks. Okay, some marks is there for the description. So you have to write down description which will carry maybe around, say, out of 5 maybe 3 marks is there for description, and your impression, the diagnosis, carries 2 marks. Then based on that you will have a viva. Now remember one part very carefully. It is not important, that whether your diagnosis is right or wrong. You may have a wrong diagnosis, but if you can justify your answer, in that situation, the examiner will give you good marks. Okay, don't worry on that. But please do not copy. Do not copy from your neighbors here and there or what others are saying. You write honestly what you are seeing under the microscope, because if you lie during the exam, it is the big turn off for the examiner and he will not like it at all. So among the slides, remember, okay, from the slides, remember one thing, that description and viva is just asked, whether it be histopathology slides, hematology slides, which will include both bone marrow aspirate and bone marrow biopsy, as well as cytology slides, as well as you might get fluids as well, which will, that is the clinical pathology slides might also be kept, so under the cyto section. So normally, remember, what do you have to do for them? So normally all these are very important and very easy exam slides, and basically you have read about that. So relating to that only certain basic questions will start. So what are the important exam slides? The slide list has already been shared in the exam group. In the third year group, we have already shared this slide list. Okay, we will share it again. Okay, not a important means it is not a big thing for me. I will share it again. Now many of you ask me that, sir, why don't you make a course? Why don't you make a rapid revision of the exam slides? You make one small session for that. Now remember, I try to do that. But for any one chapter or any one topic, if I want to revise very fast, it will take, minimum per chapter will take approximately 15 to 20 minutes. Now suppose if there are 10 chapters or there are 12 chapters, it will come up to approximately 4 to 5 hours of revision only for these slides in the practical exam. So it is not feasible to do that, because you have very less amount of time for the practicals. So what I always suggest as of now, okay, one day before the exams, how do you do a rapid revision of all this important exam slide? You have the slide list. You open the corresponding book like Robbins, Orell's, Tejinder Singh. Okay, the atlas for remember, I am not recommending Tejinder Singh to read as a hematology book. Only look at the images of Tejinder Singh as an atlas. Okay, don't read hematology from Tejinder. Read from my notes only. So you take Robbins, you take Pranabde, you take Orell, you take Tejinder, and very fast, in a very fast manner, you just see all the images very fast. Okay, that is how you revise the images. All the images will be revised within 2 to 3 hours. Very less time. Else, if I start making videos and if I go into the depth of each and every topic, in that case you will have to give a lot of time, and you don't have a lot of time. So this is the fastest way to revise all the images one day before your practical examination. Okay, sit with the book, sit with the list of all the important slides I have given you, and just start looking each one of them very fast. Then you are having the clinical pathology, hemat or biochemistry exercises in the exam. So very importantly, you are given problem cards, and the problem cards I have already shared with you in the third year groups. Now remember, every college they are having a set of their exam cards, and usually before the practicals you are shown all those problem cards. So basic important clinical situations or vignettes are based on nephrotic syndrome, rheumatic heart disease, RH disease of newborn is there, nephritic syndrome is there, blood grouping is there. Okay, diabetes mellitus, cases of HHS, that is hyperosmotic state, hyperosmolar hyperosmotic state, diabetic ketoacidosis, bleeding disorders like ITP or any factor deficiency can be there, diabetic retinopathy case, iron deficiency anemia, megaloblastic anemia, neuropathic ulcer case, chronic hemolytic anemia, eclampsia, viral hepatitis, viral hemorrhagic fever like dengue, meningitis case, lupus nephritis, G6PD deficiency case, okay, acute coronary syndrome, acute hemolytic transfusion reaction, jaundice, the differential diagnosis, urinary tract infection, acute leukemia or multiple myeloma. So all these are important clinical diagnosis which can be asked as a problem card, okay, in your exam. Then apart from what are the things that they are asking under the problem cards, what is the probable diagnosis, what is the relevant investigation, or you have to perform the investigation, like you have to do the urine analysis like urine protein, sugar, ketone body, or hematology examination you have to do like the peripheral blood smear, you have to take blood, make a smear, okay, and then do the Leishman staining, or you will be given a hemogram to interpret, or you have to perform blood grouping, Coombs test, cross matching, you have to do the fluid analysis, okay, or CSF analysis might be given, you have to do the cell type, cell count as well. So these are some of the investigations that you will have to perform yourself, okay. These are the things that you will have to do. Now the next important heading, so this was clinical pathology, then we are having the grossing or autopsy. Now remember one thing, okay, grossing, like whatever big specimens that you are grossing, like the breast, the stomach, the colon, the ovaries, the kidney, uterus and cervix. So the examiner might ask you to perform grossing in the exam. The examiner might ask you to perform grossing yourself, and these are some of the important gross specimens that can come in the exams, okay. Now apart from that, there is a section called as autopsy. Now remember one thing, autopsy in itself is a very huge topic, okay, and it is as big as systemic pathology, and there are tons and tons of information, tons and tons of books and notes, and as of now we have not introduced this, but later on we might introduce. But remember, autopsy is of maximum, autopsy and grossing, they are asked together of, maybe they are carrying 40 marks only out of 400 marks in there, so just 10% of marks might be allotted to grossing and autopsy together, okay. So for this, again I would like to suggest you, I have shared a 4-page PDF, okay, wherein they have discussed, okay, in short about the autopsy section. I have also given a PDF from your heart, the grossing of the heart autopsy from the Washington manual, and a separate video, okay, on how to dissect the brain, okay, and a video is shared regarding the same in the groups as well. So for the autopsy, this is how you should do. Usually the common autopsy diagnoses are the museum specimens that you see in your respective colleges. And what are the important autopsy diagnoses, like cardiopulmonary failure, myocardial infarction, pneumonia, or any kind of congestion is there, neoplasm, pulmonary embolism, aortic rupture, cardiac tamponade, cerebrovascular lesion, sepsis, peritonitis, GI hemorrhage, intestinal ischemia. Not only that, okay, you might be asked in the exams about the grossing of the liver, lung and spleen, which I have not covered, but shortly I am going to cover this part as well, okay, grossing of liver, lung and spleen. The next important section is tissue processing. So you might be asked to perform a H&E stain, along with that one special stain like PAS, okay. You might be asked about the microtome and how to operate, and you have to take sections also. Then frozen section, if you have the frozen section machine in your college, you will be asked questions regarding that. Whatever equipments are there in the tissue processing room, whatever tissue processing which is taking place, what is the process, and everything can be asked to you, okay. Both the working of the automated as well as the manual tissue processing can be asked in the exam. Then there is something called as the micro teaching. This is again very important. You will be given a topic, and for example, one day before you are given 10 topics like embolism, or some of them they have a topic of APLA, or thrombosis is one topic. One small topic you are given 10 minutes time, and you have to teach, or you have to speak in front of the examiner. The pedagogy session, that is the micro teaching session that is there. This will also be there in your exam. Then there are different kinds of charts that the examiner can bring, they can keep, they can ask you in your exams, like the charts of electrophoresis strip, osmotic fragility charts, HPLC charts, 3, 5 or 7 part autoanalyzer strips, flow cytometry charts, platelet function test graphs, thromboelastography, gel card interpretation might be there, okay. Then for example, they might ask you about PCR, immunofluorescence charts can be there, cytochemistry stain, they might give, and they might ask you, for example, myeloperoxidase stain, IHC stain, they might bring a chart and they might show you, like for example HER2, or for example Ki67, or for example they might ask you ERPR, okay. Then electron microscopic charts they can bring. Then a special stain chart, peripheral blood smear charts can be there. What I have added this year, that charts can also come directly from general pathology, hematology and cytology. For example, clinical charts and pedigrees might be brought by the exam. For example, in genetics, you might be given a pedigree chart and might be asked whether this is representing autosomal recessive or autosomal dominant, or what kind of Mendelian disorder. Or they might ask you about Gaucher cell, they might show you a Gaucher cell and they will ask you, they might give you an electron micrograph can be given. So some charts can be given to you directly, okay, from them, or from organisms like them. You might be asked to interpret what are these. They might give you LD bodies, or they might give you a diagram of C blue histiocytes, or they might keep instruments in the exam, or they might give you photo of instruments and ask you to interpret what is the instrument, what is it used for, or they might show you an LE cell and ask you what is this. So all these important images which you will find in Robbins, the examiner might carry a chart of that and they might show you and ask you to say. Then comes lastly your grand viva and your thesis part. Now very important, in the grand viva, okay, the examiners, two internals, two externals, they might ask you any and everything. Usually the internals are not asking any question, most of the questions are asked by the examiner. Then you will also have to speak about your thesis, what is your work, how to present your thesis. So you should always know what your thesis is about. Don't just read the heading of your thesis. You say, this is my test, this is how I did. In short, in around 5 minutes, just speak about your thesis and give an idea. The examiner will ask you what was your findings. You should be able to answer them. Okay, so this is very important. I know many of you are giving people from outside are making thesis for you. In that case, you have not worked. If you have not worked, the examiner will come to know very easily. So you have to be very thorough with your thesis work as well. So I have spoken about and given you an outline about all the important topics for this year that is very important for exams. And now I am also going to make you understand the approach, what your approach should be. So very important, in one line I would show you that you should have to multitask. So for the theories, it is very important that you first start doing the 5 to 7 year question paper, okay, of all the topics simultaneously. Now see, it is very important what I am saying right now. Suppose you are reading general path, you are reading systemic path, you are reading hematology, cytology. So whenever you start solving question, it is not like I will first complete all the questions of general path, then I am going to go to systemic path. No. If in the morning I solved 2 questions of general path, okay, then in the evening I will solve 2 questions of hemat. Then next day in the morning I will solve 2 questions of systemic path, in the evening I will solve cytopath. So you have to mix and solve all of them simultaneously. Why is it important? Because any topic, okay, is very vast and all the topics, they are never ending. Okay, so suppose if you start reading systemic path and if you keep on reading systemic path, it is never going to end. Okay, so that is why you have to start solving questions simultaneously. And one important thing, if you just read and if you don't revise, then it is of no use. So revision, all the topics that I have stated up, you solve all of them. First the 5 to 7 years question paper, then all the topics that I have listed above. Then extra important topics that you think that according to your university, those questions can come. Okay, then you'd go for those topics, and in between you have to carry on revision always. Okay, so basically what is very important, that what happens in your exam, in your viva, in your theory and everything, what happens is the fact that you are asked very basic question. Okay, and what has happened with you, that throughout the first year, throughout the third year, you are always interested to see some very rare case, some very difficult case, some very tough question. Your mind tends to concentrate on all the things that you have not seen or done. So you always concentrate on very tough questions and you want to go for a very deep reading. So from first year to the third year, okay, it is all right, you do that. But remember, between third year to your exams, you have to read very basic questions. Your basics has to be crystal clear, because in your exams, majority of the questions are basics. So what happens that, because you have thoroughly read, in the initial years, you are going for the deep reading, and it is not your fault, because the teachers, the professors, they keep on hammering you with some questions because they want to ask you some question that you don't know. So as a result, what happens, you think that those questions that I don't know or that is very tough, that they are very important for exam. No, it is not like that. In the exam, they are asking you very simple questions first. Only if you answer a lot that they will ask you something, very high-fi. Else they will never, start with high-fi question. So you need to know your basics very nicely. And practical, remember, okay, how to prepare. So for the practical, whatever you have read for theory, along with that, 3 years of residency is very important. So whatever practical work that you have done in 3 years of residency, okay, that will, form your basis for answering questions, okay, in your practical exam. Now I will give you a very mathematical approach, that suppose today is 31st May and from tomorrow 1st June, July, August, 3 months I am having. Some of them are having exam in October also, some of them in November also. So somewhere between 3 to 5 months time you are having. I am going to take into consideration only 90 days, the worst situation that you have only 3 months time. So suppose even if you solve 7 years question, okay, 7 into 70 into 4, 280 questions, okay, plus minus you also add 20 more extra topics from my end, okay, then you are having approximately 300 questions, the bare minimum amount of questions that you are having. So if you divide by 100 days, then you have to solve 3 questions per day. This is the least amount of questions per day that you have to solve. That is for 5 to 7 year question paper that you are having. Along with that, you have to carry on revisions also. Okay, so on an average, every day you target to complete 10 questions on an average. This will take approximately 8 to 9 hours maximum, okay, and minimum 6 to 7 hours it might take. You mix and match. Some questions are very easy, direct, straightforward, so you are able to revise them fast. It might take hardly 30 minutes. Some questions are very big and you need more amount of research, you need to shorten it down. It might take approximately 2 hours as well, okay. So that is why you have to mix and match whenever you schedule out your day, okay. This is how you have to, this is the mathematical approach. Approximately minimum of 300 questions you have to do, okay, and if you add all of the topics that I have given you, it might go up till 500 questions. If you are able to solve these 500 questions, you will do very well. You might get a gold medal as well, okay. Now remember one thing, why am I saying that this video is very important? Because last year I had made a video regarding the list of important topics, okay, and last year examination we had approximately 40 plus gold medalist, okay, 40 plus gold medalist. But after I had given this particular lecture last year itself, I have started this 90-day revision program. After I had given this, you will not believe that the students have followed it very nicely. And this year, by God's grace, we had 70 plus gold medalists this year. Means 70 different colleges, 70 different gold medalists this year we are having. Okay, so that is a huge jump. Okay, that is a huge jump. And I believe that this pattern, if anyone is able to apply diligently this pattern, which you will, after looking at this lecture, you are bound to succeed very nicely. You are bound to succeed very nicely. Now coming to the timetable, how you have to read. Now this is something that I have repeated again and again in every video where I have discussed the timetable. So please listen to this very carefully, what your timetable of reading has to be. Number 1 is the heavy subject. Heavy subject stands for H and it includes general path and systemic path. Then L stands for light subject like hematology and cytopathology. Then you are having RS stands for recent advances. The recent advances meaning recent advance histopathology as well as recent advance hematology as well as the WHO updates that I have already given before. And you have the miscellaneous topics like grossing, tissue processing, autopsy, clinical pathology, problem cards, etc. All these are miscellaneous topics. So how is it that you have to basically schedule your day? Now remember one thing. Suppose today is day number 1. There are 7 days in a week. So suppose Monday, this is day 1. So and I am discussing this in the worst possible scenario. In the worst possible scenario that you are going to work at morning 9 o'clock and you are returning home around 5:30, 6 o'clock. So in the worst possible scenario that even if you have to maintain this thing for the last 3 months of the exam, this is the worst scenario. Even in the worst scenario, how you can do better? So suppose in the morning hours, you have to wake up around 5 o'clock in the morning. The first thing that you should do, the first 30 to 45 minutes you have to give for revision. You have to revise whatever you have learned. Now 30 to 45 minutes means revision means you just go very fast whatever you had read in the previous day. Okay, you might not be able to recall everything, but you just go very fast. That is, the day should begin with revision. Then from there you start with your heavy subject. Heavy subject, for example, day 1 you started with general path. For example, this is subject number 1. Then suppose you attended the college, you read that and you went to the college. Now what happens that once you already read in the morning, so you become very confident that okay, I have read all these things. Okay, then you are going to your college. Inside the college, you at least read one of the recent advanced topic and one of the miscellaneous topics. So at least 1 to 2 hours inside the college you try to read. For example, today is day 1. In morning I read general path. Okay, then during the college hour, I read recent advanced histopathology, one topic I read. 1 to 2 hour you give. Okay, any break you take, you go. Okay, 1 to 2 hour you try to read in the college. Go to the college library and read. Then suppose your work is finished around 5:30 p.m. Around 6 p.m. you came back home. So you take up one of the lighter subject. Okay, suppose you took in the day 1 you took hematology. Okay, then you read the hematology in the day 1. Then suppose after you read 2 hour hematology, again you read some of the miscellaneous topics. Suppose in the afternoon you read one topic of grossing or one tissue processing. In the evening you read about autopsy or clinical pathology. Okay, so this is entire day 1 I have done these things. So it is a very productive day and you will not become bored. Okay, and even if you have college, you can adopt this kind of learning. Okay, the second thing, suppose this is day 1 Monday. Suppose day 2 the same thing. On a Tuesday, what I am going to do, that again I will start with the revision, but today I will not read general path. I will read systemic path. I will read the other heavy subject. I read certain questions from systemic path. Again I went to college, but today I read some other topics. Okay, instead of reading this, I read some problem cards or I read clinical pathology, something like that. Again today, when after my work I went home and I started a light subject, like suppose day 1 I read hemat, so today I read about the cytopathology. Then for example, you go home, you read either recent advanced or miscellaneous topic, but you read mix and match and read. So yesterday if I read recent advanced histopath, then today I will read recent advanced hematology. Do like this, or today I will read about the WHO updates. So the importance of breaking down and doing all things together is the fact, the first thing, you become more productive. The second thing that is important, that with this you will not get bored. The third important thing, you will not miss. What happens many times, because there are so many things you have read, okay, but you have some time also, but you did not remember that you forgot to read about autopsy, you forgot to read about clinical pathology, you forgot to read this part. So if you divide everything and if you give each and every time to each and every topic, then in your brain it is very less likely that you will forget anything. Ideally remember 7 to 8 hours per day consistently during this 90 days. If you have already read something before, at least some part you have read before, then no one can stop you from getting a gold medal or distinction. Now I am not telling you that getting the gold medal or distinction is something. I'm trying to tell you is that if you do, and if your luck favors in your side and you get those important questions, whatever I have discussed, then there is high chance you will get gold medal or distinction. This is what I'm trying to let you understand. Okay, I'm not glorifying a gold medal or distinction. I'm saying it is possible. You will do very well in your exams. Now one counseling part I want to say right now I will tell you something. In the counseling or in the tip, what is very important is the hours are not important. It is not like today I will sit 7 to 8 hours, sir has told me, and I am not doing anything nicely. Okay, then it is of no use. You are sitting for 8 hours, you are doing only 3 questions. That is not acceptable. You are sitting 6 hours, but you read nicely, you read fast and you completed 10 questions. Okay, you can take an early off. So it is the quality of reading that matters. That is very important. One very important thing, I have been saying this again and again, that pre-plan a day before. So suppose tomorrow I have to discuss 10 topics, I will solve this 10 questions or this 7 questions. Then today only I am going to see what those 7-8 questions I want to resolve tomorrow, and I will also go and check where the answers are there. Suppose in my app so and so section this answer is there. So tomorrow I will just wake up, I will see those videos or I will see those notes and I will revise this question from here. You should know from where you have to revise. It should not be that today I got up early morning, then I don't know what I have to do, then I am deciding today 2 hours gone over here. It is of no use. So pre-planning a day before, okay, 15-20 minutes, okay, and you should get a proper sleep. Physical activity is again very important and enjoyment is very important. You should keep yourself happy. The first thing in the morning that you should do is you should never touch the phone. You should always start reading, have your tea, whatever you are doing, but don't touch the phone before you leave for your college. Concentrate on yourself and your studies only. Okay, revision, do not ignore revision, is one of the most important parts. And one thing I would like to add over here is consistency. Consistency of reading is like today I read 7-8 hours, then for 7-8 days I have not done anything. That should not happen. Okay, else your continuity will break. You should be consistent in your approach. Last opportunity to read so much before the exam, because once you will pass, you will always say, I will read, I will do this, I will do that, but you will never do those things. So read with an open heart, with enjoyment, read. Okay, don't push yourself too much or don't get too fixated. I have seen certain students who are excellent students, but they are pushing themselves so much that in the end, that is in this last 90 days, by the time the exam is coming, your mind is completely drained and you are just not able to read. One day before the exam, you are not able to do anything. Don't do that. Okay, do not drain yourself or do not overexhaust yourself. You have to choose an optimal or middle path. Okay, so what is very important, some days you will read nicely, some days your mood will come down, like this. This is a proper path that you should follow. The graph is not linear up or down. It is always something like that. Some days will be, good, some days will be bad. Okay, like for example, today you solved 10 questions, you are very happy, but maybe tomorrow you were able to solve 8 questions, your mood was bad, or you did not, or the teacher scolded you, or something happened. Okay, or you had a fight with your husband or your wife, or with a boyfriend or girlfriend. Something will always take place. Or you started seeing the social media, you're seeing your friends are enjoying your life, this, and you became depressed. Okay, so this is all right, but for example, it should not be that today I have sat, I'm not having any food also, nothing. Today I solved 20 questions. Okay, and I drained myself completely. Or today I became depressed, I solved only 1 question. Both the approaches wrong. It should be a optimal or a middle path has to be there. What is the worst thing that can happen? The worst thing that can happen is fail, or you might have to repeat the exam, right? Okay, so what? I will fail, but I will give my 100%. That I am not going to fear. So आज पढ़ लो, बात की बात है. Fail and repeat and pass is for the end. Today you have to read nicely. You should not fear, and you should tell yourself, okay, even if I fail is no problem. I want to read and I will read. This should be the attitude. So suppose if your attitude is this, then you are going to perform excellently well. Okay, garner positivity and refrain from negativity in the exam. And one important thing that I would like to ask you is practice how to write, because last year a very good student in general pathology, a very good student, she knows all the 10 LAQs in the exam. Okay, she was able to write only 7. Time management was very bad. Okay, if one question is suppose they ask you everything about diabetes, if you write everything, it goes on till 15-16 pages. You have to summarize it into 6 to 8 pages, and you have to understand that I have to give this much time only for this question. So this is something that is very important. Time management is very important. The girl just got 51 in general path because she could not write 3 questions. She knew the answer, she knew about it, she barely made it. She just barely made it. Okay, so remember, this part is very important. The practice of writing is important. So examination, some things that is very important is the admit card. You have to preserve, carry your admit card in the exam, carry a watch. Suppose it is a 3-hour paper, 10 questions are there. So how much you are getting? 3 hours means 180 minutes. Divide by 10. On an average, I can give 18 minutes. Now I also know that suppose certain questions will be very small, you will complete in 10 minutes. Whereas certain questions will be very big, you might need around 25 minutes as well. So you have to balance it accordingly. Okay, there is nothing which is saying that you have to write the answer like 1, 2, 3, 4, 5. You can write answer 7 first, then you write answer number 4, then you write 3. So till you are writing the answer number correctly, it is not a problem. Okay, you should carry your thesis, you should carry your exam logbook, you should be well dressed, haircut, well shaved, and remember the professors are always right. Remember, you should never argue, you should not act smart with the professors. Remember this point. Last year, out of the 5 students who have failed, 1 student had argued with their professor and HOD when she was in the first year. Okay, she had given exam, she topped the practical, but she was failed in the theory. So basically, do not argue. The teachers might keep a grudge. I'm not saying that all of them will do that, but I'm just saying to you that this might have consequences. This is what I mean to say to you. Do not get afraid. I'm just trying to give you some important hints and points. Theory paper time management, as I told you, give you an example. Last year was one student, okay, and you should always write all the answers to the point. Carry your own microscope in the exam. And for practicals also, time management is very important. For every slide that you are given just approximately 5 plus 2 minutes, maybe 7 minutes are given to you for any one slide. In that time you have to see, you have to write, you have to give the diagnosis as well. So this is what is very important. And one more thing that I wanted to add over here, that you should always fill up, never leave any question blank. Never leave any question blank in the exam. This is very, very important thing, because as I told you, if you leave that blank, 100% the examiner is not able to give you any marks. You will get 0 for that question. And lastly, I wanted to give you an idea about the question papers and the questions that come. So for any questions, if you see, remember one thing, 70 to 80% of the questions will be repeat question, or they will be one of the questions from whatever list of questions that I have given. Along with that, 20 to 30% of the questions might be a bit odd, or they might be new. Now try to understand what you people do, that you start running after these questions. But remember, these questions, they are from a pool of more than 5,000 questions. Whereas this 70 to 80% question which is coming, it is from a pool of 300 to 500 questions only. Okay. So which is more easy to cover first? Absolutely, this one is more easy to cover. That is why over here the 70 to 80% of the question that is coming, it is the basic question. It is an easy question. And this 20 to 30% question, when it is coming, okay, it will be from a new. So you cannot always predict, okay, for this 20 to 30% question, okay, I can do 60 to 80 questions extra, I will do for this. That is something else. If it comes. If it doesn't come, it's all right. But this 60 to 80 question that you will solve, it should not be at the expense of this. You have to absolutely first complete this, 300 to 500 questions that I have given you. Then only after that you can go for the new questions. Now remember one thing, this 20 to 30% questions, okay, that I told you can be odd or new, and this 70 to 80% repeat. This pattern is basically a standard pattern. We call it a standard question paper pattern that is asked. Okay, it is not difficult. What is difficult, I will tell you. Suppose 50 to 60% of the questions, okay, that for example you read, and approximately 40 to 50% of the questions, okay, so 50 to 60% questions came from the question bank that I have already given you, or from the list of topics that I have already shared with you, or they have come from the last 5-year question paper. If it is like that, and suppose 40 to 50% of the questions that has come, they are new completely, that you don't know, then it is basically a difficult paper. And remember one thing, it is not like always your all the 4 papers that you are getting, always it will be standard paper or an easy paper. Okay, it is not like that. Maybe paper 1, 2, 3 was easy, paper 4 was difficult, or paper 1 was difficult, 2, 3, 4 was very easy. This can be like that. Maybe in a particular university, every year for the last 5 years the paper were easy, but this year it was difficult. It can be, and it is exceptional. In many colleges, it might be that approximately 90 to 100% of whatever questions are there, they are from the repeat section, very easy. And 10 to 20% of the questions, if you see, they are new. So then it becomes a easy paper. Okay, remember this. Remember, whoever are the toppers in the exam, okay, their highest can go approximately 77 till 79%, something like that. If you ask me personally what was my percentage in my exam, I scored approximately 74% in my exam, and I topped my own college. My university, I was a 3rd or 4th topper like that. Okay, but my college I had topped. Okay, but in my university there were other, because the examiners are also different, and maybe the students have read more as compared to me also. So the topper marks is basically somewhere around 75%. The toppers usually get this marks. Okay. So with this, I hope you have understood in details what you should do, how you should approach the paper. This timetable that I have given you, this is for your 90 days, and this same timetable you can use in the first and second year. The only difference is during the exams you give 7 to 8 hours, but during your first and second year, even if you give 3 to 4 hours or average of 3 hours, just divide it something like this. This is more than enough. Okay. So with this, I hope you have got a good idea about everything, and I am also going to share all the important exam materials in the third year group very soon. Okay. Thank you for watching this lecture.